All right, welcome everyone. Thank you so much for joining us. We'll give everybody a second here to get in and get started. Happy summer, LBDA community. I don't know about where you are, but here in Philadelphia, it is hot. So I hope you're all staying cool wherever you are. Welcome to session 12 in our 2024 webinar series, Empowerment Through Education. I'm Julia Wood, the Director of Professional and Community Education here at the Lewy Body Dementia Association. And today's going to be a little different than what we've done the last few sessions. We're going to have an interactive wellness workshop today on exercise with my friend and colleague and one of my favorite physical therapists ever, Dr. Joellyn Fox from our University of Pennsylvania Research Center of Excellence. So before we get started, a few words about LBDA. So we're a national nonprofit dedicated to maximizing quality of life for those living and affected by LBD. And we do this by providing comprehensive education through events like this, compassionate support for those living with LBD in our support line, and we'll be putting resources for that in the chat a little bit later. And also we really work to advance awareness and research about Lewy in the community. So a few housekeeping items for you. You can select the show captions button at the bottom of your Zoom toolbar at any time during the presentation. You'll notice there's also a resources icon on that same toolbar at the bottom. And that has some downloadable resources that are curated for you, including, in this time, I'm not lying, a PDF of the slides for today. Last time I didn't get that up in time. So I promise this time it's there. You're also welcome to submit any questions that you have throughout the presentation using that Q&A icon at the bottom of the screen. And following Dr. Fox's presentation today, we'll address a few questions from the audience for about 15-20 minutes. And so for those of you who haven't noticed, to simplify access to our webinars like this, we've added a ribbon on the home page at lbda.org to direct you on our website to where you can register for upcoming webinars and also find a link for our YouTube channel to watch recordings of all of our past content. This presentation is being recorded, and an email will be sent to those who registered with a link to view the recording in about 1 week. And Rose is going to drop that link in the chat for you. And then lastly, when you leave the session today, a brief survey will appear asking your feedback about today's presentation. Please take a moment to complete that survey because that helps inform our future content, especially for next year. We're already working on that. So let's learn a little bit more about who's in the audience today joining us. So Rose is going to launch a polling question that you can answer on your screen. And you'll notice, you guys, this time you can pick more than one. So we've had some of you go, hey, I'm a care partner and my person with Lewy is here with me. So you can pick both if you want to. And that is totally fine. All right. So it looks like our care partners and our people with Lewy are running neck and neck. I feel like I'm at the Derby here. We've got some former care partners with us, some healthcare providers, some families and friends, and then also some researchers and scientists. So give that just a little bit longer, let you all have a chance at it. All right, I'm going to end that. All right, so you can see that we've got about half of you are people with LBD or symptoms, at least, of Lewy. And then we've got 64% of care partners, and this includes our spouses out there. We've got some former care partners, as I mentioned. Thank you for joining us, healthcare providers. We love to have you in the audience. Family and friend, of course, our researchers and scientists and everyone is welcome. All right, thank you. So we'll cut that out. And then we'll get on with the show here, shall we? All right, so I'd like to take a second to introduce our presenter for today. And like I said, she is a dear colleague of mine. I had the honor and privilege of working with her for many, many years at the University of Pennsylvania. And so I want to introduce Dr. Joellyn Fox. Here we go. So she is a graduate of Lehigh University with a dual degree in biology and psychology, and a graduate of Temple University's doctorate in physical therapy program, who resides in Philly. So she's nice and hot and steamy with me here too. She's been a clinician for 19 years, but you wonder how, because she looks like she's not a whole lot older than that. And she has 16 years of specialty treatment in Parkinson's disease, and we treated together at the Dan Aaron Parkinson's Rehab Center. She's also an adjunct professor at Widener University and Rutgers University. She helps us out with LSVT global courses. She's certified in big and power and rock steady boxing. She runs marathons like crazy. She ran the New York City Marathon as a Parkinson's champion and the Chicago Marathon as well. And so she was on teams that's raised nearly $750,000 for Parkinson's. And so I think with that, you can tell she truly lives the motto that exercise is medicine. So thank you so much, Joellyn, for joining us. It's so good to see you.
Thank you so very much, Julia. So right now I'm going to share my screen. Thank you all for this invitation to join you today. I am so very thrilled to be here and to have this opportunity to share, as Julia mentioned, my love, and that is movement and how movement impacts us all. And even though we are a 50-50 split, when we get moving, I encourage everyone to move, because as we talk through the benefits specifically for Lewy, it's good for all of us. And here are things that we're going to highlight today. They are the why. Why are we here? And it may just be that it piqued your interest, the word exercise. You're already doing exercise. Perhaps it's something that you know you should do. But why specifically? And we're going to jump into the research just a little bit. Then we're going to balance our talking with our movement. And I established these chapters, our focus and our follow. We're going to address stretching, aerobic exercise, strengthening, balance, and then we're going to end with some tips to follow. So let's get right to the nitty-gritty of why are we focusing on this? Well, the National Institute of Aging, as well as the Alzheimer's Association, has found an incredible amount of research that staying active has numerous benefits for people that live with dementia. It can reduce our symptoms of anxiety and depression. It also can reduce our blood pressure, positive effects on body and system, reduce joint swelling associated with arthritis, improve balance and coordination, reducing the risk of falls, improving self-esteem, improving sleep, and maintenance of motor skills. So keeping our function, keeping us going. And why I like this list, we're talking about motor things that make sense, our muscles, how we move, but then also things that we might not think that exercise can improve, such as mood, such as the quality of our sleep, such as the quality of our day-to-day and our safety. The World Health Organization has already put out a big initiative saying that all older adults who are physically capable, including those with dementia, should perform at least 150 minutes of moderate exercise during the week. So I take pause. Physically capable, what does that mean? So whenever performing or choosing to get started in exercise, it is very important that you check with your healthcare provider that you are safe in your system. So cardiac, pulmonary, neurologically safe to perform them. Once you get that clearance, then absolutely, it's the how do we achieve this? And we'll talk to strategies moving forward. It can seem daunting, 150 minutes, but you can break it down into 30 minutes, 5 days a week. Now, what about this intensity? So the moderate intensity, if we look at a scale from 1 to 10, 1 being very, very light activity, and 10 being, I hope, what I'm giving my effort as I cross the finish line and think, what did I do signing up for this marathon? Moderate activity puts us in this 4 to 6. You're breathing heavy, but you can still have a conversation, get some words out, and give a response to somebody that's asking you a question. So I mentioned that we're looking in these organizations, from Alzheimer's Association to the World Health Organization, is looking at the impact of exercise with people living with dementia. And there is such a great amount of literature that's already been established of the importance and effectiveness of exercise in populations that have similar symptoms to Lewy body dementia, such as Parkinson's, as well as Alzheimer's and other non-motor dementias. Now, this study here, which was just published in 2022, a pilot study had been published a few years prior, is the PRIDE study. PRIDE standing for Promoting Independence in Lewy Body Dementia Through Exercise. And what it is it's the first study to specifically evaluate the effects of a progressive, high intensity, so higher than that 4 to 6, exercise program in those living with Lewy body dementia. And it found some really positive results. There were 3 key findings, but before we jump into them, the group that was involved, so those that were involved in the study had Lewy body dementia, but were separated into 2 groups. One that participated in this progressive exercise regimen, and a second that was waitlisted. Waitlisted because they were not receiving the intervention, so that over time, after the intervention, both groups were tested. So the group that did the exercise and the group that wasn't doing any exercise, to see if there was any difference there. But we want to encourage the benefits of participation in a study. So that waitlist group then went on after that retest occurred and went through the program of exercise themselves to seek the benefits that were had, because there were. A key finding was the improvement in an individual's functional independence, which is a big thing. Oftentimes when people come into my clinic here, one of their biggest goals is, I want to maintain my independence. I want to maintain my safety. I don't want to become a burden on someone else. Well, this is wonderful. The key thing of this study is we need to intervene early and get people living with Lewy body to move, to exercise more. Functional independence is very much relying on a person's balance. If you are a falls risk, it is important then that you may have or need greater supervision or use of equipment at home. Functional independence means having that stamina, that endurance to perform activities within or outside of your home. Ultimately, it also improves quality of life and did improve in this study a lower severity on a dementia scale. Those who were not doing any of the exercises showed an increase in frailty. Frailty plays a role in fluctuating and the disease course, increasing the progressiveness of it. So any way in which a provider and your healthcare team can look and evaluate that person living with Lewy and try to decrease the risk of frailty increasing, we've got to implement. This study shows that a progressive exercise program does reduce frailty in those that were exercising versus those that were not. The program of progressive exercise went over the course of 8 weeks. It targeted strength and balance as well, including some activities that also increase in heightened heart rate response, so could be considered aerobic. Not only did we see change in those independent rating scales, but also in a person's body composition, their nutritional status, and their overall day-to-day physical activity. So real big thumbs up. Working in from a research standpoint with individuals living with Lewy can be hard to recruit. So this was a really pivotal study to show that, yes, it can be done. And yes, we need more of these type of studies so that we can generalize to the larger population. So do keep your eyes peeled, clinicaltrials.gov. You can do a search to see if there's any current studies, or ask your healthcare provider and team if there are in your area. So that was a big plug for exercise. Physical activity, okay, can also equal exercise. Some people have never exercised. Some people have exercised in their past, but haven't been at it or to it in quite a long time, and it can seem quite daunting. But I encourage you, if you're not an exerciser or have reservations about exercise, to make a list of physical activities that you may enjoy. You can start going through this list and checking off ones that you would like to do together with your care partner or friend or family member. Then also too, going through that list, I often, with people that I work with, brainstorm ways to remove possible barriers that may prevent that person from participating in that activity. So for example, if a person enjoys swimming, but can't climb down a pool ladder safely, or has a lot of fear of falling with that ladder, we can try to find a pool with a ramp or simple stairs for easier access. Also, too, you want to try different activities until you find something that you enjoy. Be honest. If you're not enjoying it, say so. Move on to the next thing. You want that stimulation, you want that motivation in order to continue. Some activities that you might want to consider trying include gardening. Believe it or not, grocery shopping. A little plug for grocery shopping. You know, some people are quite organized going in with a list. I love the little cognitive dual task or little trick of saying, we're going to go to aisle, let's pick a number, let's go to aisle number 9. Walk into aisle number 9. Aisle number 9 is cereal. Okay, let's go through our list. What on this list can we find in aisle number 9? Then you jump to a different aisle. Let's call out number 1. Jump to aisle 1. You can see where I'm going with this. Rather than going up and down all the aisles, one at a time, now you're jumping aisle to aisle and getting more steps in. So that's a way to kind of make a game out of it, make a greater activity out of it, and for it to take longer. Bowling can be a great activity. You can adapt bowling so that you can be in a chair to do that as well. Dancing can be adapted as well. Even everyday chores. I don't know if that's fun for most people. Me, myself, I love doing laundry, but to each their own. That too can be a great activity to do. So when you even think of something like watering plants, if a barrier that you brainstorm through is the safety of carrying that water can, perhaps you're sitting and the watering pot, the pots to be watered are placed in front of you and you have to reach, and maybe you make an activity that it's set up in a semicircle and you're going right to left and then alternating side to side. So you can see how you can get creative with these activities and make those activities more of an exercise. So let's start talking more about exercise and active ways to get involved. Our first focus is going to be stretching because as people age, unfortunately, things change. So our collagen levels decline, and that can lead to less flexibility in our bones, in our muscles, in our tendons. Bones can also shrink and become less dense. We have scans that we have to do as we get older. And muscles can also lose size and strength. This is something that just happens with aging, unfortunately. That loss of water in our tissues and our spine can increase our stiffness and decrease our elasticity. So without certain disease diagnoses, just as we get older, things change that honestly, truly should be addressed through exercise. When we reduce flexibility because of the aging process, when we do reduce flexibility because we're sitting more and moving less because we're living with Lewy and we have changes in our walking, changes in our balance, which overall impact our activity, we see a reduction in the ability, so flexibility, the ability of our bodies to move and achieve their range of motion for that joint. This in turn can lead to more back pain, more spine stiffness, discomfort when sitting, discomfort when sleeping. That discomfort in sleeping can then impact the quality of your sleep, which then impacts your energy levels the next day and that willingness to participate in exercise. So you can see where all this is going. It can also impact abilities for functional mobility. So our front muscles of our legs in front of our hip, okay, behind our knees, if those areas get tight, it's going to impact our stride length, the speed at which we walk, the ability to clear obstacles that might be in our path, and likewise the ability to react to a loss of balance because of a trip or a near slip. So let's try to target together some stretches that we can do to just address the typical aging process or changes when we become less active to our body. What I'm going to do right now is I'm going to stop sharing my screen, and you're just going to see me big front and center. Holy smokes. What I'd like you all to do is be comfortable in wherever you are sitting. I'm going to slide this away so you can see me better. And know that as we go through these movements, if anything hurts, you stop. Instead, focus on your breathing. Perhaps reduce the amount of motion that you are taking. Key rule of thumb is never push yourself through any pain. So what I'd like us all to do, apologies for that little noise as I slide the camera away, and hopefully you can see me a little better here as I'm sitting tall in my chair. Right now you may be sitting such that your back is against the chair. What I'd like you to do is to come forward slightly in that chair and place your hands on your knees. Now, I want you to address the alignment of your head related to your shoulders, related to your hips. Stay as you are as I turn my body, because what you may feel is that your head is forward, your shoulders may be rounded, your back may be rounded, your tailbone may be tucked under, but it's how you are sitting. You might have already tried to correct it. That's what we're going to do now in pulling shoulders over hips, placing feet firmly on the ground, and rolling your shoulders back. What I'd like you to do is to check the range of motion in your neck to see if you can achieve all directions without any pain. Look up to the ceiling and hold here for 3, 2, 1. Look straight ahead. Bring your chin down towards your chest and hold for 3, 2, 1, and look straight ahead. Look over your right shoulder, rotating. Try not to twist your trunk, holding here, and look straight forward. And now look over your other shoulder. Try not to make any funny faces at anyone, or if you're looking through a window, making any faces at neighbors, and forward. Give yourself a hug. Thank you for being here. That's my hug to you. Now open your arms out and pinch your shoulder blades back. Again, round forward and give yourself that hug. Allow your chin to come down towards your chest. And now open forward. Let's do that one more time. Give yourself that big hug. Round it out. And now open, open, open. Elbows come back, chest is lifted. Now keep that, relax your shoulders down, hands come down, take a deep breath in through your nose. And exhale. Now relax your body completely. You may round forward again. Now pull yourself back up to where we just were and hold here. Now round forward and pull yourself up and hold it here. Take one arm and reach it high and overhead. Stretch out that side of your body. Hold it here. 3, 2, 1, and bring it on. Back down. Opposite arm, reaching across, holding here. Big, big reach, hold strong, and bring it back down. Let's do that one more time on each side. Arm comes up and over, correcting for any slumping that you may be doing off to one side. Bring it back down. Opposite arm, up and over. Reach, reach, reach. And bring it back down. Now, scoot further towards the edge of your chair. Extend one of your legs out in front of you. You won't be able to see this on me. Place your heel on the ground. Reach your arms up. Bring your arms down to your thigh. Now, carefully and without pain, try to flex forward, reaching down towards your toes. And slowly roll yourself back up to a seated posture. Bend that knee, bring that foot back, bring that opposite heel down, arms come up, arms come down to the thigh, reach forward. How far can you go? It's the hamstring limbo. The hamstring is a muscle behind your leg, and right now it's getting a nice good stretch, no pulsing, just holding, and then you bring yourself back up. Now let's do a little imagery. Let's imagine that we are somewhere with snow and we are lying down. Let's take one last deep breath in, like we're making a snow angel in that snow, reaching high, palms are open, and exhale to lower down. Inhale, take a big reach up, get dramatic here, and bring your arms down. And let's do that one more time. Inhale, bring those arms up in a nice big way, and lower down. Congratulations, you have just stretched out some of your postural muscles, and we've addressed some of those areas of flexibility that I was just talking about. We're going to go back to our slide deck and move on to our next block. That next block is aerobic exercise. Drum roll, please, because we're going to talk about something fancy right now, and that is the hippocampus. Perhaps when you meet with family and friends, you can share that word and discuss a little further, but the hippocampus is a complex brain structure, and it's deep in our temporal lobe. It has a major role in learning and memory. There is research to show that increased hippocampal size is linked to improved memory function. Now, how can we increase that hippocampal size? Well, through aerobic exercise. We do not have a study specifically linked to people living with Lewy body dementia. We are talking more so with people in other non-motor dementias, in Parkinson's disease, and in our aging demographic. But we know there's healthier changes. We know we need to do more research about this, and that's a really positive thing related to other symptoms of Lewy body dementia. We know exercise is also, aerobic exercise is linked to changes in the brain by improving the oxygen supply, and it increases something called brain-derived neurotrophic factor. And what this does is it plays an important role in neuronal survival and growth, and it serves as a neurotransmitter, that which is being released in our brains to help sequence and coordinate and get the neurons to fire to the muscle in our bodies and our systems. And it also participates in neuronal plasticity, which is really important for learning and memory. Aerobic exercise is a mode of exercise where we elevate our heart rate and sustain it at an elevated rate for a set duration. Sometimes people monitor aerobic exercise by that heart rate, or will monitor our aerobic output through what we perceive as our perceived exertion. That was that 1 to 10 scale that we previously reviewed. So if you have not received clearance to exercise or get that heart rate up, you can just observe. But what we're going to try to do for the next few minutes is in place, get our bodies moving to see how it feels to elevate that heart rate with continuous movement and maybe even break a sweat. But really what we're going to work in is that moderate intensity level. So you should be able, if I asked you a direct question, you should be able to answer me back. If you feel that you're going more to that high intensity effort, I want you to stop for a moment and take a few deep breaths and then jump back in with me. So let's get started. We're going to add in that intensity. I'm going to stop sharing my screen and we're going to get our bodies moving. So I'm going to slide back. You're going to take a nice deep breath. Perhaps if you have some water near you, you're going to take a sip of that now. So you're going to bring yourself forward to the edge of the chair. You are going to set your feet wider than they currently are and flat on the floor. You're going to bring your arms out to the side and right now address if you have any shoulder pain. If this is a lot of effort for you, I want you to stay in this range only, okay? If you are able to bring your arms overhead without a lot of discomfort, your range is going to be from down all the way up. So together, we are going to do a set of 10 from down all the way up, down all the way up, down reach, big up reach, down and up. Keep going. Good. You have 5 more. Big reach up. 4. Good. You have 3 more. Keep it going. Apologies for that last 2. Keep reaching. 1 more. Hold it up here, reach it higher, 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 and stop. Start to march and march. Lift and lift. Hands up. I'm timing you here. We have 30 seconds of marching. You're going to keep your hands by your sides. Keep marching. Keep marching. If you feel like you can increase the tempo and march a little faster, you go for it. Keep it going. If you would like to increase the intensity more than that, you can hold your arms out to the side. Keep lifting, lifting, lifting. Good. We're almost there. Keep going. You've got it. 5 more seconds. And 4. You have 3 and 2. And stop right here. Deep breath in and lower down. You're going to take your right knee up. You're going to clap up, clap under, relax. Try that again. Knee up. You can lean into the back of your chair. Clap up, clap under, relax. Again, I want you to get loud at home. Knee up, big clap, big under, relax. Again, knee up, big clap, big under, relax. Nice job. Again, knee up, clap high, clap under, and relax. We're going to take this to the opposite side now. You may shift your weight. You may lean back into that chair. Take that opposite knee up, clap high, clap low, relax. Again, knee up, clap high, clap low, relax. Again, knee up, clap high, clap low, relax. Keep going. If you're having difficulty raising your knee, you're just going to clap high, clap low, relax. Clap high, clap low, relax. One more time. Clap high, clap low, relax. Sit tall, deep breath, and lower. 30 seconds of marching before we advance. Timing starts now. Lifting the knees, relaxing that posture, correcting that posture. Remember, you can up the ante by picking up the pace. If you need a break, stop, take a deep breath, and just restart. Otherwise, you're marching and marching and marching, and find a happy place that you want to be marching in. I'd like to be marching in the cold ocean somewhere, which I heard the Jersey Shore is still in the 50s, so that will suffice. Let's keep going. March, 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 march. Focus on that breath. Feel the body moving. Find a tempo. Get your trunk into it. Help the legs out. You're almost there. You have 5 more seconds. 4, 3, you've got it. 2, deep breath. Inhale to reach the arms up, and exhale to lower down. Now, what I want you to imagine is a clock. Your head is the center of the clock. 12 o'clock is directly above you. 3 o'clock, 6 o'clock, 9 o'clock. What I'd like you to do is take your hands up, lean back. You can lean back into the back of your chair, and we are going to punch up towards 12 o'clock. We punch, 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 punch. If you can pick up that pace, you go for it. Otherwise, keep the pace that keeps you in that intensity of 4 to 6. Let's keep punching for 5 more. Good. 4, 3. You've got 2. and 1. Excellent. Palms together to give them a stretch. Now, rotate. You're going to punch over to the side of your clock. We punch and punch. Now, if you have any discomfort in your trunk, you can take a leg over, okay, if you're in a chair without arms, and punch out. If you still don't have a chair without arms, you can just stay as you are and just punch out in a diagonal. But try to get that rotation in the trunk, and we punch and punch and punch. Good. So what you're seeing is my body leaning forward, leaning back, leaning forward and back. If you want to increase that challenge, you just pick up that pace, get more of your body involved, keep punching and punching, keep it going for 5 more sets. You've got it. And 4, last 3, and 2, good, and 1, and stop, palms together. Nice job. Deep breath here. Guess what? We're going to that other side of the clock, my 9 o'clock. Here I go. I'm going to rotate over, give that other side of my body a chance. I'm going to punch and punch. Lean back, lean forward, big punches, feeling strong, finding that rhythm, and keeping that body moving for 5 more sets. Keep it up. You guys are doing great. I might have you all come in and we can go up the rocky steps together. Give me 3 more. Good. And 2. And 1. All right. Palms together. Nice deep breath. We're stretching out the hands by putting those palms together. Now you are going to pound down towards that 6 o'clock. Down and down. Keep punching down, pulling the hand up, punching down, pulling the hand up. Now, let's play around with speed here. All together, let's go a little slower. Good. Now go fast, 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 and go slower. Down, down. Go fast, 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 fast. Now slower. Down, down, now fast, 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 and pause, palms together. So why did we change paces there? Sometimes to try to elevate and get yourself at a pace and sustain it there for several repetitions or for several minutes of duration is very difficult to do. What we just did were intervals. They were very short, but we did intervals of slow and intervals with higher effort. And that in research has been shown to give positive effects from an aerobic exercise standpoint as well. So really positive with that. Another way that you can increase or up the ante with movements that you can even do sitting in a chair, guys, I've broken a sweat here, is you can get your arms and your legs moving. So marching and punching is a great way to increase the challenge or a goal to progress up to. So again, and what we'll talk about further with more tips is starting small and growing big. Also realizing is, hey, I'm not into this punching type of business. Finding a movement, maybe it's more dance-like, that is enjoyable to you. And again, that's why you seek out and reach out a healthcare professional to guide you towards exercises that you find the most enjoyable. But thank you for joining me. Like I said, I had to kind of do the boxing theme because of being in Philadelphia and Rocky. I can't tell you all how many times I have heard the theme song to Rocky. We won't go there because instead we're going to go to strengthening. And what we're going to talk about now is our next mode and our focus, which is to strengthen the muscles. It's important that our muscles have flexibility and range of motion so that then we can get those muscles to contract by adding resistance. Resistance can be added just by gravity. It can be added by additional weights, and we'll talk to how we can do that. to then stimulate the muscle to contract. The muscle then grows. What muscles are important for us to strengthen? Because what we know is that Lewy can cause muscles to get weak and to get stiff. We're going to do something about that. So one of the key muscle groups are our postural muscles. Postural muscles, you kind of think of that theme, if you don't use it, you lose it. That if you're sitting with poorer posture, you're not activating your muscles like we were just with sitting with better posture. So specifically in our upper trunk, we want to look to our neck and make sure that we're focusing on retracting it and keeping it back in that alignment. We want to look to the muscle that is in our upper back that helps to keep our scapula, that our wings, if you will, in their neutral alignment, versus when that muscle gets weak and stretched out, that we have that rounding forward, and then our pectorals in our front get tighter. In terms of our thoracic spine, which sits below the cervical spine, really as a physical therapist, I'm always addressing in people and listening to spouses and family members, care partners that are around, if there's more slumping to one side in particular. Addressing that, is it a slump forward? Is it a slump lateral? Where are we? How can we support strengthening and stretching? Our core. A lot of times people think that's just our abdominals, but really there's deep muscles in our abdomen as well, in our pelvis, as well in our low back. And that can help to support a lot of things, not only from posture and stability, but really even can be engaged in our pelvic floor muscles too. And that's a whole separate lecture. We have muscles for movement. Just getting up out of a chair, you're activating your gluteal muscles, so that behind. When you go to stand up, the muscle in your front of your thigh, your quadricep, is activating to bring that knee into a straight position. When we go to sit down, our quadriceps, as well as our hamstrings, are working to help us sit down. When we go to take that first step, what are dorsiflexors? Well, they're the muscles in our shin that are raising our toes up so that when we step forward, we can clear that foot and step down. So we have many more muscles than what I just listed, but these are really important muscles to focus on strengthening throughout an exercise program to make sure that they stay as they should and improve if they've declined. To go back to that comment of if you don't use it, you lose it, is that if you are sitting more and moving less, those muscles contract and relax even during functional activity. So just walking, doing that grocery store walk, you are activating all those different muscle groups. And just in that activation, they're maintaining strength. If we want them to grow strength, then you can think of adding resistance. And adding resistance means, well, geez, I don't have access to resistance. I don't go to a gym. I don't have equipment at home. Guys, we all have equipment at home by just going into that kitchen and pulling 2 cans out of the cupboard to utilize for upper body strengthening. Likewise, just gravity alone can add weight to the body in terms of movement. I'm not asking for any family member to sit on you or for you to try to pick something really heavy up. But again, you start low and then you grow big. So let's think of some ways together and practice of how we can strengthen some of our muscles that we utilize for posture that are important. And then likewise, utilize for our functional movements. And what we'll think to is just a sit to stand. So as I transition out of the slide deck, what I'd like you all to think about, and honestly, guys, this is a great exercise to do when you're in a car, when you're in a plane or a train, but also just sitting there and waiting. And what this is a glute set. So just in sitting, thinking of squeezing your glutes like you're pinching a penny. So this is called an isometric contraction. And what an isometric contraction is just contracting the muscles, but not seeing a movement, okay? So by squeezing your glutes, you might feel your pelvis rise up a little bit, but you're not seeing a leg kick out or a hip extend. Your muscles are contracting without a gross movement, But in that contraction, what you've done is that brain has sent a signal. The neurons connecting into the muscle are firing, and that muscle is contracting. We hold. If you just squeeze and relax, that's a brief contraction. If we hold it for 3 to 5 seconds and then relax, that's a more beneficial contraction for strengthening. So think right now, we're squeezing, holding, pinching that penny, and then relaxing. Something as simple as just doing this in a chair and relaxing. And give me 3 more. Squeeze, 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 and relax. And 2 more. Squeeze and relax. And 1 more. Squeeze and relax. Hopefully all of you have water bottles, maybe probably glasses of water, which I wouldn't do if you're at home. But if you have something like a water bottle, I have stickers on mine. It keeps me smiling during the day. You can just hold a water bottle. Maybe you start with no water. You can add more water for more weight. And you practice rowing to work on that scapular muscle, okay? Pinching those shoulder blades together. That's a great exercise to do. And sometimes when I tell people to just get them in the habit of moving, I say to them, if you take a sip of water, you owe me 10 rows, okay? If you take a sip of water, then you owe me 10 overhead presses. Again, you should be doing this movement without, okay, any pain. Another great thing that you can do with a water bottle, and I'm going to stand to demonstrate this, but you would do it in sitting, or actually I can stay sitting, you can see this quite well, is if you were to hold the water bottle by your side and kind of like a little teapot, put a hand here or down here. You keep it straight back, you feel a little contraction in your oblique, and you sit back tall. Okay, so lower down and come back up. And that's a great side bend exercise, again, for posture that you can do with just a water bottle. If you've done a couple reps on one side, let's make it even and try it on the other side, and just a couple there. So a great way to just take simple things in your home and work with them. Another great exercise to do if you're in a chair is having hands on the armrests, pushing down through them to push forward, and pushing down through them to come back. Okay, so if you have those hands on those armrests right now, let's do that together. Where you push down, bring your hips forward, you're also pushing through your legs, and then push down to go back. We want to work those triceps and engage those muscles and keep that scooting function present because it's really helpful for our sit to stand transfers. Let's do 3 more, pushing forward and pushing back. And 2 more, pushing forward and pushing back. Excellent job. And 1 more, pushing forward and pushing back. Very good, guys. So now we're going to toggle back because I really want to go into balance. So bear with me now and focus on taking a breath. Scoot yourself back in your chair and give me that good posture that we had just a little bit ago. Right. And here we go. So, balance. Balance is a really obvious, important thing to talk about because of the impact of falls. Balance truly is our ability to maintain our upright posture, despite one of my favorite words, perturbation, from our environment. Now, what does that mean? A perturbation can be you transitioning from a hardwood floor to a rug, because the rug has more fluff. All of a sudden, it's changed how your center of gravity is over your base of support. A perturbation can be something more significant, like going from a level ground to a sloped ground down a ramp. Oh, that's perturbed my balance. And one of the most common ones is if someone pushes you, knocks you, the wind blows you. That's a perturbation. When our body is perturbed, okay, physically, not emotionally, sometimes we get perturbed in those ways as well. Our 3 systems in our body act in concert to try to maintain or reattain a stable environment. and a sensation of being well balanced. We have balance systems. So our visual system is one of the three. So you may have noticed that if you get up in the middle of the night, balance well, number one, you could say it's groggy, you're groggy, but also too, if you're in a dark environment, right? Your balance seems different. It's not as easy to just walk because we rely on our vision for our balance. Vestibular, our inner ear. Okay, if you've ever had a bad cold and been really stuffed up, you may have felt dizzy, okay, or not as stable on your feet. Proprioception is our body's ability to know where it is in space. So to kind of put that into a medical context, if somebody has peripheral neuropathy, where they don't have good sensation in their feet, their nerve endings in their feet aren't working to send signals up to the brain, it really impacts balance. You know, if you step onto something cold on the floor, why? Oh, I have a sensation, I have a feeling. You know, if your toe has gotten caught or didn't go into the sock right, because you feel where that toe is in place and in space, and that's our body's proprioception. So those are our balance systems that work in concert. We also have our reactive balance strategies, so that if a perturbation occurs and we need to recover, how does our body do that? Ankle strategy, when you're standing on that really grassy or uneven area and you feel your ankles working, or if your neurologist or physical therapist is testing your balance and says you to stand on one leg and, you feel that ankle working a lot. Well, that's that ankle strategy, trying to maintain your center of gravity over your base of support that then got minimized because you're standing on just that one leg. We also have our hip strategy. So say you step out onto something that you weren't expecting and you slip a little bit and your arms go out and your hips move. Hip strategy. One of the most memorable ones for most people is if the perturbation is grand enough that you physically take a step. Okay, what we know is that with aging or loss of flexibility, with certain diagnoses that make our bodies stiffer and slower, that our reactive balance strategies can slow down. So it's important to look to them early on before you even have any balance problems, because what are we doing for our balance? We've got to practice, okay? Dynamic movement. I never send people home and say, practice standing on one leg. That's not functional. Really, it's about feeling your body and using your systems and your balance strategies in a safe way, but a productive way. So let's try that now in sitting, and you're really going to feel something. A lot of people really don't think you can work on balance in sitting, but you absolutely can. So I'm going to stop my share here. Okay. So what I'd like you to do is, again, sit more towards the middle of your chair. Your hands are down, but if possible, if you can keep your hands across the chest, I'd love to see that. We're looking at your truncal balance. And what I'd like you to do is imagine like you're circling around in a circle. Okay. So a clockwise circle, you're going to feel your weight go forward. Feel your weight go to one side, off to one hip. Feel your weight go back and perhaps your core engage and go the other way. Good. Let's try that again, but going the opposite direction. Going to the side, going back, the other side, and forward. Again, side, back, and keep your back nice and straight. Don't just lean. You want that trunk to move and to feel that weight shift around in that circle in that plane. Now, I'd like you to take one hand and reach out. I'd like you to reach out at a diagonal. Reach, and bring your hand back down. Take that opposite hand out. Reach at a diagonal. And bring that hand back down. Bring both arms forward. reach forward, and come down. Now a tricky one, reaching low. The intent is to not go beyond a limit such that you don't have any weight through one side of your body. Take one hand and reach low as if you were reaching down towards your foot or something that you may have dropped on the floor, and come back up. If you do not have the flexibility to reach all the way, that is fine. That is something to work on. Within the range you have, you will feel your balance and how your body is able to, those systems to maintain, oh, I'm keeping my balance, I'm keeping my balance. I'm back in my neutral alignment. I'm going to go the opposite way now. Reach for that opposite foot, coming down low, and then sitting up tall. And try that again, coming down low, and sitting up tall. And a way to challenge just even seated balance with rocking, with reaching, is changing the surface that I'm sitting on. By just taking a pillow and sitting on that, I up the ante considerably in terms of how those balance systems have to support. If I close my eyes and take my vision out of it, then I'm relying more on my inner ear and my proprioception to support. By adding that uneven surface, it makes my proprioceptive system work harder. So it's challenging that. So there are a lot of ways to build and develop and progress in terms of balance, even in a safe way, just in sitting, but a productive one. So we've hit our focus points, and now I'd like to share some tips. So tips to follow. Bear with me here. Okay. Tips to follow. Start slowly. I love this quote. You don't have to take the whole staircase. Just take the first step. I really think all of you being here today is taking that first step. Now it's what you do next. Don't bite off more than you can chew. Don't rewatch this and try to do everything. Please don't Google search and try to do all the videos. Seek guidance as to what would be best for you so that you feel productive, feel accomplished, feel that you can attain and finish that exercise and feel the benefits of it. Because that activity or that exercise may need to be adapted to increase the enjoyment. We can add music. We can perform the activity with a friend or family member. We can use colorful items like balls or balloons that encourage movement through passing. Okay, I love doing that in a group setting, passing, and then all of a sudden you determine who likes what colors because they gravitate towards those. You may have to adapt the activity by reducing distraction. So setting an exercise or a specific activity space so that attention doesn't go towards the television or perhaps out the window. Reducing clutter in that space as well, so that the body and the brain and your vision perceive enough room to move and engage in the activity. Also reducing noise that the brain might be distracted and go towards. Don't let it be boring, everybody. Boredom can absolutely decrease our motivation. We can increase the interest by changing the activity. And I kind of love thinking of days of the week and picking a theme, like mix it up Mondays, and Mondays is the day to do a lot of cooking and standing activities or prepping and sitting. Tai Chi Tuesdays, right? Weight training Wednesdays, track time Thursdays, and perhaps your track is in your neighborhood. Perhaps your track is that you're walking in the grocery store. Perhaps your track is that you're tracking that you're doing marching sitting down, and you're tracking the number of marches that you can complete in a day. Funky Fridays can be a dance party. That's a great form of aerobic exercise and adding that in. So just a couple ideas to mix it up. What I showed you today and what you experienced was demonstration. I was asking you to follow my lead, which is really hard to do virtually because I can't see you, and modify and support you. When I am with people, I often encourage, let's do this together. If a person doesn't follow me in the right way, a lot of times I'll stop. I'll just say, let's take a deep breath. I may try it again. If it doesn't work, by trying it again and repeating, I'll just go on to the next movement. I love the phrase, do as I do. I love getting feedback. What do you feel? How was that? How hard was that? Was that fun? Another tip is encouragement. I tried to be encouraging to you guys to keep your interest going. I was using intonation in my voice. I was trying to be a deranged cheerleader. A lot of times enjoyment brings participation. In clinic, the goofier I am can really help motivate a person that absolutely doesn't want to do what I'm asking them to do. Doing it for yourself. Okay, so that was a bit of the why. All right, the research is out there. This is beneficial for you. It's not easy. No. I mean, a lot of this is behavioral change. You might not be that active anymore. You might not exercise, but you're doing this for you. All right, the control is back to you in living with this disease because you can start an activity or exercise program. Also, too, I'll sometimes ask people, help me with this. And I could use your help doing this activity. Say it's cleaning, say it's doing the laundry, say it's going grocery shopping. Please help me with this activity. And that can increase engagement and encourage a person to move more. Making it social absolutely serves as a reminder. You don't want to disappoint or let someone down because you're not there. It also adds a sense of purpose, enhances our sense of belonging, and encourages our well-being. It also boosts mood and quality of life factors. Julia and I shared an amazing time in this clinic where we had several group exercise classes. Not only did it boost the mood of those attending class, it boosted our moods as clinicians where we worked. We absolutely saw that more people would come to class earlier and earlier and stay later beyond the classes because of the social engagement that it gave back to them. Because socialization provides a controlled but also a varied climate for us in our human interactions, and likewise in the environmental interactions, getting us out of our house. And being realistic. Consistency is important, but sudden exposure can be too much. So to jump into something and say, I'm going to go for my 150 minutes this week. Whoa, pull it back, pull it back. Also, too, what that leads to is often sporadic, that you do too much all at once, and then your body feels something because of that, which decreases the motivation to do again. If you don't schedule it or incorporate it as part of your day-to-day, it can also become more sporadic. And when it's more sporadic, it doesn't have as good of a benefit. Realize, too, that there are going to be good days and bad days. And I'd like to use something that I learned about professional elite athletes in their training, and doing this with the Paris Olympics right on month this in a couple weeks. And that is that it is in training for elite athletes that say 100% of their trainings, okay, and this is well known across many different types of athletes, that 25% of the trainings are golden. They are like, yes, this is it. I'm on top. I've got this. 25% of trainings are absolute, okay, it didn't work. The body wasn't responding. Something was going awry. And 50% being the majority in elite athletes, 50% of their trainings are meh, comme ci, comme ça. It's not always going to be golden. Okay, the most important thing to realize is that you're moving, you're putting effort in, you're also listening to your body, you're getting it done, okay, but also within the context of what's real in that moment. So hopefully I gave you some ideas today if you've already engaged in some exercise but have had some barriers. I gave you some knowledge in terms of different modes of exercise and why it is important to stretch and it is important to strengthen. We know a lot, I think, across the consensus of the importance of aerobics and balance, but then also ways to just participate. Participate with the family members that you have, seeking greater access to what might be in your community. Thank you all.
Excellent. Thank you so much, Joellyn. That was fantastic. And tell him your dog's name. That's Joellyn's dog.
Yes, that is Stewie. He is an 11-year-old rescue, a Great Dane lab mix, who has a very high fear of fireworks. So it's been a traumatic week for the stew man, but he's hanging tough.
We used to laugh because she had one of those little thunder suits for him. So it looked like he was in like a leotard.
He was in it, Julia. He was in it.
Oh my goodness. And I have to tell you guys a little funny aside too. So explain about your name. So you're named after your grandparents, right?
Yes, Joseph and Ellen. Joe and Ellen were my grandparents. Yep.
So she would always, in the time we worked together, she would get Jonelle, Jolene,
Jocelyn, Sue Ellen, there you go.
Yeah. So if you're trying to remember in the future, you can think Joe and Ellen. All right, my dear. So we got some questions for you. That was a fantastic presentation. So helpful. So, we just had one of our more recent webinars was on dysautonomia. And so we had Dr. Shannon Chu, who I think might be in the audience with us today. And of course, orthostatic hypotension is a big issue with that. And so this individual was asking them, right, they don't want to don't want exercise to lower his blood pressure. So do you have any recommendations of how to get exercise when someone is struggling with that OH?
Low blood pressure. So absolutely. So one thing, and your healthcare provider might have already recommended compression garments such as compression socks or abdominal binders, but that can be helpful to support activity tolerance to be able to walk more. Also realize too that although we did a lot of chair-based exercise, there are exercises that can be done in more of what we call supine, so lying in a semi-reclined position. Okay, or completely reclined. You can also engage in activities too, in semi-reclined positioning. I've had people who are really into art, but I made it more of a reaching activity, okay, that do suffer, and I'm speaking specifically to a woman with multiple system atrophy that's coming to mind, which she has severe orthostatic hypotension, and it really worked well with her from a reaching standpoint, a flexibility standpoint, et cetera. So also too, not negating the importance of fluids, thinking to the good times of your day. Sometimes people, and that might be based on when the extra class is or when a family member is available. But if that's not a good blood pressure time of day for you, because say it's right after you've done your grooming in the morning and you've had a lot of activity already, it's not the best time to exercise, even though it may seem to be because you have your care team around you.
Excellent. And you guys, I noticed that Rose popped in the chat as well the link for Dr. Chu's webinar, because she had some other tips in there too for trying to manage that orthostatic hypotension. All right, thank you. So next question we've got here, and I think this is true, we with Lewy, there's a lot of different stages, right? We know that people early on, and definitely where someone is physically changes that too early on. Someone could be very deconditioned or very conditioned. But this individual commented that exercise is really wonderful, but at some point, as the condition's progressing, it's more challenging to keep moving. So what do you recommend to kind of keep people moving toward those later stages?
So one thing, and this might be something to come that'll be discussed, is something that's called passive range of motion. So in much later stages where it's difficult to move, and or when we talk about our energy levels, that it zaps all of your energy to engage in that exercise, and then it makes it difficult then to engage in your day-to-day activities. You're too tired to support feeding yourself or dressing yourself, and that's meaningful to you. Then we need to addressed and conserve energy and allocate that energy to meaningful tasks. Later in disease process, one of the most beneficial forms of exercise to still implement is flexibility. And that's because it prevents pain from muscles getting too tight. So I would say the best way to put it is that the exercise transitions from being active to passive, so that somebody's supporting your muscles through a range of motion and giving you that stretch. Somebody's supporting you in just position changes so that your body, because of gravity, feels a different position, and that is still stretching, so that you can engage in an activity. And that simple engagement of a card game or a tablet that you might be using is still active reaching and, function in a way that's getting contraction. So I would say the takeaway is that transition from active to passive, but then also the allocation of energy, okay, into what is the most meaningful activities.
Thank you so much.
Sure.
So, a lot of this, I know sometimes people are confused. Do I go to a physical therapist to support my exercise routine? Do I see an exercise professional? Kind of how do I navigate that? So when do you recommend that someone begins seeing physical therapy, and how do they kind of incorporate and work between fitness professionals and physical therapists?
So for exercise prescription, living with Lewy, my recommendation is that you receive a consultation with a physical therapist first. Reason being, a physical therapist licensure and how they're accredited requires a knowledge base of systems, okay, rather than muscles, movements, and exercise protocols. So really there's a larger education towards autonomic dysfunction in an individual and what to do about that, and likewise the disease process. Now, it's not to say that in my clinical practice, I haven't referred people to certified athletic trainers if I feel that they need support and coaching through an exercise protocol or even the motivation, okay, and that they have the means to do so. But really, that's a referral too. Now, I don't have people, because then this becomes an access question where people say, well, I don't have someone who knows Lewy body dementia. And, that's the utilization of the Lewy Body Dementia Association to find providers closer to you. And oftentimes when I'm establishing an exercise protocol for people, that's not that I'm expecting them to come in to see me 2-3 times a week. It may be that I see them for that evaluation. We follow up to run through all the exercises. I send them off with their care team, so their care partners at home. And then we might check in on a monthly basis to see how things are going. It might just be, here, run with this program and reach out to me if you have any difficulties, and we can brainstorm through such that they wouldn't have to come back into the clinic.
Excellent. Excellent. And we saw, a lot of times in our clinic too, it was commonplace for trainers or group exercise instructors to come in and want to see what physical therapy was doing and get advice, what can I do safely with this client? So I think developing that relationship is really important too. All right, we've got a lot of questions here. Let's see. We go to this next one. So this gentleman, I think this is really about brain change and exercise. So this individual says that their hippocampus is at the 8th percentile for their age group. Is it possible that aerobic exercise could increase that level? I love that you know the volume of your hippocampus.
I'm so impressed that you know the volume of your hippocampus, and I'm curious about my own.
I know, it was making me wonder.
I don't have the literature on hand to say that based on the percentile that you are in, the impact of aerobic exercise as it would have. I do think that's a great question to ask based on that discussion. Unfortunately, I don't have that answer. I can do a little digging in the research. I'm not sure if I'll find that exactly. But it is something perhaps that we can measure more of. But interesting question.
Absolutely. I know, I thought so too. I had to throw that one at you. So this we have a question from a care partner who has a rebounder that they use that has like a bar they can hold on to. And she's asking if that would be good for someone with Lewy to use.
So the rebounder with the bar. So for all those, think of a trampoline, okay, that's on the floor and it has the bar to stand on. So here's why I say no. Because the perturbation that it's giving, okay, is good in that there's a lot of perturbation, but then likewise, there's a lot of recoil from a rebounder so that the perturbation occurs, but then it's continuing to do this. And from a sensory stimulation standpoint, that can be a lot for a person, and likewise the vestibular system to react to. Where a rebounder could be beneficial for a person with Lewy body to use is not to stand on, but rather to have inclined and tossing a light ball to, because then it bounces off the rebounder in different directions so that you can be seated and bouncing it to it, and it bounces in different ways.
Absolutely. And, I think that we get the question sometimes too about like treadmills or things like that. And again, I think go ahead and comment to treadmill. Sometimes people will be like, well, why is it safer to just walk on the ground than it is to walk on a treadmill?
Yeah. So a treadmill, when you think of it, walking on the ground, you're propelling yourself. When you're on the treadmill, now there are certain treadmills where you're propelling the belt, but those are in very elite training gyms. Most treadmills, you hit start and that belt goes. And therefore that belt is propelling you. You're keeping up with it. A lot of people think to treadmills, well, I get all my steps in a controlled space. I don't have the room to do all my walking. But really, it's propelling you. You're not propelling yourself. And likewise, your handholds are bringing you into a posture that you wouldn't be walking over level ground with. So really, it is preferred to do level ground walking more so than the treadmill walking.
And I do have a colleague at LBDA that will remain nameless that got shot backwards off of a treadmill and injured their hip.
I've done it, not recently, thank goodness it has happened, because all it takes, folks, when you're on that tread is if you get distracted, and that's what happened to me. I got distracted and was talking to someone and I veered too far on the belt and my legs went out from under me. So it's falling off the treadmill is quite a common thing, and all it takes is a distraction.
Absolutely. And you guys, we know that attention with Lewy is often really impacted. And so that's something I think to think about that Joellyn brings up that's an important point, is being able to attend to whatever the activity is also safely. So another question here. So this individual's been to a regular PT for balance and gait, and they're asking if it would be important now to get a consultation with a PT that's more specialized with Lewy body dementia or diseases that affect motion.
So without knowing the specifics of what the recommendations of your current PT are, it's hard for me to answer that question. But you have my email address now so that you don't have to share those details about specifically what you're working on with that PT. Please email me. I'd love to hear what you feel your deficits are, how the therapist is engaging with those deficits, and what your specific goals are. So if you could email that to me, I would better be able to support you.
Excellent. And you guys, we've talked before too, and we have a few courses in our Lewy Learning Center to remember where we talk about access to therapy, especially the Unpacking Parkinsonism course. We have some ways that you can find neurologic physical therapists, that you can find physical and occupational therapists through LSVT Global. The Parkinson's Foundation is another. You can reach out. Joellyn and I are both faculty for the team training program. So we educate PTs and OTs and working specifically with people with Parkinson's related movement disorders. So there's a lot out there that you can find. Thank you for that question. Let's see, we've got time for one more question here, I think. So would exercise be the same for someone with Lewy body dementia and Parkinson's? And there's a second part of that question that I'll address where they ask, why is a movement disorder neurologist recommended over a regular neurologist?
So is exercise the same for those two diagnoses? When we talk about the volume of exercise in someone, say earlier in stage, yes, we want to try to get that. When we talk about, if we look at the big pizza pie of exercises with the portions of flexibility, strength, balance, and aerobics, yes, those apply to both. But then there's specifics of each disease that would adapt the exercise specifically to what that person's symptoms are. And that's unique to the person living either with Lewy body or with Parkinson's. Okay.
Absolutely. And you guys, per the movement neurologist question, that kind of depends. So a movement neurologist, remember, is going to really be astute with treating Parkinsonism. So those changes that impact mobility and gait and balance but also looking at all the non-motor symptoms as well. So sometimes if people have a good degree of Parkinsonism, so you've got a lot of changes to your movements, you're slower, you're stiffer, then a movement disorder specialist might be who you see. Sometimes people go more to a cognitive neurologist if that's more the specialist in your area or your changes are more cognitive. We have people at Penn who see both. They kind of volley back and forth between the two. So I think that it really depends on what kind of your primary issues that you're facing are, on which type of neurologist. But I think that they all can have benefits sometimes as well. One last question, because I think this will be a quick one, and I thought we weren't going to have time to get to it. Ask if saunas are good for people with Lewy body dementia. Any thoughts on that?
Well, I'm going to defer to your healthcare team on that one. And talking to your doctor about the use of a sauna. And here's why. It can impact your heart rate. It can impact, obviously, you're going to sweat, and what your thermoregulatory abilities are, okay? What your resting blood pressure is to begin with. So I've got to defer to the medical doctor on that one. Great question.
Excellent. Thank you so much.
Yeah.
And you guys, if you don't mind, now that we've got the reactions working again, take a second and let's all give Joellyn, let's show her some love. Using our reaction buttons. Thank you so much.
Yes,
this has been such a fun session, but unfortunately we're all out of time. So on behalf of the Lewy Body Dementia Association, I'd like to thank you all for taking your time to show up and participate with us today. And also thank my dear friend, Dr. Joellyn Fox, for empowering us all to get out there and get moving. So please keep an eye on the Lewy Learning Center for some upcoming exercise videos with Dr. Fox, where she's gonna be able to kind of lead you through things like she did today, and that you can do from the comfort of your home. And we're hoping one of those will be some passive range of motion exercises. So a little something for everybody out there. As a reminder, you're going to get an email in about 1 week with the link for the recording of this presentation and also the resources and links that we talked about today. We invite you to visit that new landing page and stay informed about our upcoming webinars. We're only doing one this month because it is summer, but we're going to be back. So mark your calendars for our next session coming up on Thursday, August 15th at 2:00 p.m. We're going to learn more about sleep symptoms in our Counting Sheep webinar with Dr. Bhavana Patel from our RCOE at the University of Florida. So, of course, finally take a moment and do that survey for me that's going to launch when you leave to inform our content in the future. We hope to see you all again soon. Please stay safe out there, enjoy your summer, and stay cool. Thanks so much. Bye, everyone.